Welcome to If You Know Someone with a Vagina,
or as we like to call it, ICSWAV. IYK.
SWAV. Hi, I'm Sandi.
And I'm Beth.
We are recently retired nurse practitioners, excited to bring you a podcast filled with informative insights, compassionate discussions, inclusive perspectives, and expect a healthy dose of humor. Whether you have a vagina or you know someone who does, this is the podcast for you.
The content of this podcast is provided for general informational and entertainment purposes only and is not intended as, or should it be considered, a substitute for professional medical advice.
Today's episode, The Pelvic Pokey, the ins and outs of your pelvic exam, is for anyone looking to better understand the pelvic exam, what it involves, why it matters, and how to feel more comfortable during the process. You may be asking yourself, when would I need a pelvic exam? Well, do you have unusual vaginal symptoms like abnormal bleeding, pain, itching, unusual discharge or odor? Are you going for your first pap smear and don't know what to expect? Are you anxious about it?
Oh, well, we know how that feels, and that's why we are discussing how to first even make your appointment with the right provider. And then Sandi will explain the ins and outs of your pelvic exam. And just as a reminder to our listeners, Sandi was a women's health practitioner for many years. Remind me again, Sandi, how many vaginas have you seen?
Okay. Tens of thousands.
Wow, that's a lot of vaginas.
Definitely. And yes, we're also, guess what?
What?
All pink inside.
Oh, I like that.
It's lovely, yes. But we know the healthcare system can be confusing. But after today's episode, we sincerely hope you feel more prepared, empowered, and confident in what to expect.
When you're expecting a pelvic exam.
Good one, Beth.
So I never see your dimples, your softness or your wrinkles. They are beautiful to me. Beautiful to me. I am beautiful.
Part 1, the patient perspective. And duh, we're patients too.
Has this ever happened to you? Let's get personal. So, Beth.
Yes, Sandi.
How old were you when you had your first pelvic exam?
Well, I was 19 years old, so quite a while ago.
Oh, well, a few decades.
But yeah, I was back from for the summer for my first year at college. And I had become sexually active. So my mom, who was very open about these things, she was a nurse also.
Cool mom.
Yes. And she decided it was time for me to start getting my hoo-ha checked. Yes. Or as we would call it professionally, a well woman exam. And this was way back in 1989. And the recommendations at the time for well women visits were annual comprehensive exams, which included breast and pelvic exams.
Right, every year.
Every year. So anywho, there I was. And really, my mom was with me, is really what I really remember. And everything's pretty vague, but I do remember being in stirrups and looking at the female provider who was in between my legs, looking at my private parts. Mm-hmm. And I was just thinking to myself, who in the hell would want to do this job? Swear to God, that was what I was thinking.
Well, I can tell you, I have had patients say that to me while I was doing their exam, saying, why would you do this?
Right? And that's exactly what I was thinking. I realized like the importance of being there, of the checkup, but I just could not believe someone would want to do that for a living. But, lo and behold, 25 or so years later, there I am with Sandi, looking into other women's hoo-has.
Mentoring you was one of the highlights of my career.
Aw, we did. We had a lot of fun, and we also, it's important for women to take care of other women, so.
I think so too.
Yes.
And then again, like I've said in other podcasts, it's God just gave me certain experiences to point me in the right direction of where I should be, because to tell you the truth, like in nursing school, I didn't want anything to do with that gynecology.
Oh no. And we were so young.
Oh, so young, inexperienced, and I was just like, no, why would I want to do that? But once I was, led and that was the need at the clinic at the time, then I said, okay, you sure? You had to pray about it a little bit. Are you sure? And then look what happens. It was one of my absolute most rewarding experiences. And I wouldn't be doing this podcast with you if I hadn't said, okay.
That's a great story.
So, I'm glad.
But I want to hear about your
experience. I could tell you that mine was back in 1985. And at the time, the advice for pap smear screening was to start at age 18 or within 3 years of becoming sexually active. So I hit that point at 21 years old. So I was already an RN, actually, by that point. And I was working in a hospital in the ICU, so totally badass.
You are a badass. That is amazing.
Yeah, love that too. I love the pace, and I was totally type A in the ICU, and then I get home and I'm like totally B, type B. I just want to sleep and eat.
Oh, it's exhausting though. Yeah.
Yes, but totally fun and exciting too. But I'd been to other providers actually before that point, like Planned Parenthood for birth control, but there's never any pelvic exam involved. So I didn't need that before I went in for my pap smear. So when I went to my very first well woman visit, I went by myself because I was, again.
You were a badass.
Yeah, that's right. That's what I thought. And the provider happened to be like a middle-aged man. There weren't any chaperones at that time. And it seemed fine until he did my breast exam. And then he decided to make comments while he was doing my breast exam. So he said, nice.
Ew, Sandi.
I know.
Ew
is right. And I mentally and emotionally froze. I don't know why I didn't say anything.
I imagine because you were unexpected. You did not expect that. That was supposed to be a professional visit. You did not expect that unprofessional behavior.
Totally unexpected. And nothing could come out of my mouth. It's like, when you're dreaming and you try to scream and nothing comes out. It's just like that weird out of body kind of experience. And I still, I don't know. It was like, I know I need a pap smear. So, that's coming next. Exactly. Let's get this over with. So, so I knew something was off. So I wanted the exam to continue. And I don't recall anything out of the ordinary during the pap smear or the pelvic exam. But I can tell you one thing. I did not go back for 3 years.
Because you were traumatized.
Yeah, I didn't even put in my mind like I'm just not doing this, especially because the pap smear was normal. And I'm like, well, I don't need to go back, or I just didn't want to go unless I had an issue. So it just does things to your mind when things like that happen. But after I moved from California to Hawaii, then I just maybe felt more comfortable, and I said, okay, now I'm going to go to a female physician, and I'm going to get back on track with my pap smears. Okay. So that's what I did. And I didn't have any problems with her. I had changed insurances, and then I ended up seeing more than one male provider. I probably saw several.
I've seen male providers too.
And
very professional.
They were great.
Yes.
And even one had like a waiting list because the women just loved him so much. It was so gentle and easy to talk to. And
so yours was an isolated incident.
Yeah, very isolated, and that was back in the day with no chaperones, or they didn't make it
mandatory.
A mandatory, or
maybe not mandatory.
Well, now even before now, but probably the last 2 decades, there are chaperones in every exam for women and men and any gender of provider
Oh,
to
that's good
have
to
a
know.
chaperone. So, and that protects them too.
Exactly.
So both of you feel more comfortable. And then, sometimes the patient doesn't want a chaperone because they want to talk to you in private. And, but then they'll still say, but for this exam, I need my assistant to come in or my nurse. So, I mean, then everybody feels more comfortable. But the main thing is the patient is comfortable. I would say our main takeaway today is to empower you, our friends and listeners, to feel in control during a very vulnerable yet necessary medical exam.
Speaking of vulnerable, thanks for opening up today and sharing with our listeners your story.
Wait, did you say
What?
opening up?
Oh, Sandy.
Like,
open up and scooch. Scooch down and open up, Sandy.
we're sorry.
Part 2, the provider experience. Hey, Sandy, can you give our listeners some advice and insight into the whole seeing a provider experience?
Yes, I can. Because, you don't really know the system until you're in it.
Yeah.
Like really how to do things. So my first question when I was in my 20s and needed to see a provider was, how do I even find a provider?
Yeah.
I had no idea, and I was a nurse at the time. So clinic stuff is way different from hospital stuff. So I had no clue. And you may be asking yourself at the point that you need a provider, is this a vagina emergency, or do I just need to make a future appointment for something like a pap smear or birth control?
Just so our listeners know, Sandy, emergency rooms see patients using a triage method. So the heart attack, the car crash victim, the person having a stroke, or somebody with a knife wound, they're obviously going to get seen first. So probably not your best option for that, because you could be waiting hours and hours.
Yes. And thank you, ER nurse
What?
Beth.
Stop.
Yes.
Did I mention that before?
You did, totally. I know, and I didn't love it either. Because you said you didn't like it. Woo! It takes a special nurse.
I was not that special. I'll tell you that right now.
Thank you, all the emergency department nurses out there. We love you. Yes. So I do have, I will give you my top 3 provider finder recommendations. So hope, I know this is going to help someone. That's my main goal. It's like, you need help. So here's number 1. If this is your first time ever with a vagina problem, your first call is to your family doctor or your pediatrician, because they see teens, 18, 19. I've seen them keep their patients that long. Or a nurse practitioner, which is an NP, a physician assistant, which is a PA, and sometimes they're easier to get into and will spend more time with you.
Mm-hmm.
So any of those are good, but it's those ones that you normally go to for your non-vagina related checkups usually, and they may or may not even do pelvic exams, but you know what they will do?
What, Sandy?
Is refer you to someone who does. So, and they're in the system, so they know who they already, who they go to,
right?
And
who they think would be a good fit.
Yeah, great reputations, and even like personality fits as well. So yeah, good point. Number 2, if you already have an obstetrician gynecologist or an OBGYN, NP, midwife, or PA that you've seen before who is already prescribing your birth control or doing your pelvic exams, then you don't need to introduce your vagina to someone new.
Yay.
Yes, that's the best thing ever. Yes. And if you do need to introduce your vagina to somebody new, like for an annual exam or pap smear, I would first ask around and get recommendations from friends and family. And you could also look for Find a Provider tool on the website of your health insurance plan, or you call the number on the back of your insurance card, or try the website at your local hospital or clinic. Number 3, the urgent care. So let's say you have a vagina emergency. Trust me, we know what it feels like. And we're like, do I go to the emergency room? But like...
you might be waiting a long time.
Yeah, like Beth said, urgent care is better as it's a step down from emergency department. And so you might be at home when things happen, or you might be away on vacation. So this option of your friendly neighborhood urgent care, which I've used in the past also.
And worked at, Sandi.
That's right. So the inside scoop for this one, peeps, that a lot of people don't know is that you can often call and make an appointment at an urgent care. So just call and see, whichever one you're closest to, and see what they have. Otherwise, it's usually a first come, first serve basis. So just get there as early as you can if it's one of those urgent cares that don't have an appointments, but a lot of them do now. So try that. So what to expect from any of these appointments? So you call first. It's less likely that you'll have to repeat your symptoms at the window.
Right, when everyone's listening.
The worst.
Yeah.
So if you walk in and you have to state your current situation and there's no privacy, consider like writing it in your phone, like you're starting a text.
That's an idea.
That you'll never send or show it to anyone, but you'll show it to the receptionist and they can just read it.
Right?
Yeah, so you don't have to say it out loud.
Lobby that you have a vaginal infection.
Exactly. Attention, waiting room.
Although some people don't care, right?
Yeah, but they're bored. So what else if unless they had headphones on, they want to hear everything. So for vaginal complaints, they may also want to know upfront if you have any abnormal bleeding with your symptoms. That's a whole other visit, and you want to make sure that you have a specialist for that.
Oh, okay.
And abnormal bleeding is a different ballgame. So it's not a simple swab. It's a really in-depth exam. It might consider biopsies, imaging, a lot of other things to happen during that exam. So ask up front, too, when you check in, do you need a urine sample?
Because you're going to have to pee.
Yeah.
Or you're going to pee before you go into your appointment.
Right.
And then they're going to be
like, well, I just cleaned up.
Yeah.
So I don't want to, wreck it.
Wreck it, Ralph. Surprise, you need.
Yeah. So
a urine sample.
Yeah, guarantee though you will need to use the restroom while you wait, because you don't know how. Hopefully your wait's not long because you have made an appointment. So as soon as you go into the exam room, here's what's going to happen. They're going to hand you a cup and ask you to pee, because one of your symptoms was probably, it burns when I pee. But it may just burn on the outside, but I can't really tell. So that's why I say when you go in, ask the receptionist, because you'll probably need to pee anyway, and say, if I do need a urine sample, or need to give you a urine sample, can I have my cup now?
Right.
Yeah. So
good advice, Hannah.
Yeah, and then the provider will have the results before they even walk in the room. So they will likely also, at all these appointments, take your blood pressure, pulse, count your breaths per minute, take your temperature, weight, and measure or ask your height. So these are all actually important, because they either catch something else that's going on, or it's going to be for comparison and trends at future appointments.
Because everything's online now. All of our records are.
Yeah, it's all electronic. Exactly. And so that's great, because if something happens where wow, you had great blood pressures last year and now all of a sudden they're off the charts. Or some people think they lost a bunch of weight, or they'll say, God, I feel like, I lost 20 pounds in a month, which is scary because it's could that be cancer or thyroid issue? I know you don't like the C word, but you know, then you can look back and say, you know what? You only lost 5 pounds. Like, don't even worry about it. That's totally normal. Like, you could lose that during having a bowel movement.
Woo, Sandi.
Hey.
Yes, please.
So be prepared that they're going to ask you about your sexual history. They're going to ask about birth control, previous infections, and everything about your previous and current symptoms. When did they start? What order did they arrive? Have you tried anything to improve your symptoms? Did anything help? What makes your symptoms worse? Does your partner have any symptoms? When was the last time you put anything in your vagina, and what was it? Any new soaps, laundry detergents, sprays, lotions, potions, near or inside the genitals, because this will help them diagnose your problem, because some things just really mimic everything about a yeast infection, but it's not that every time. So, and some things are just an allergic reaction. So if you know that going in, you could maybe write it down, or at least... Yeah, right? If you have a memory like mine,
right?
Yeah, I got to write everything down. So best practice is actually not to put anything in your vagina for at least 24 hours prior to being seen, because this can interfere with the test results. So no douching.
Never douche.
And don't be a douche. So no sex, toys, fingers, penises, tampons, or medications up in there at least 24 hours prior to being seen, if at all possible.
Right.
Yeah.
So, Sandi, what can our listeners expect when they go in for their vaginal exam if they've never had one?
Great question. Yeah, I didn't know when I was young.
No, scary.
Nothing. I didn't know what to expect. But if you go in armed with some information, it'll make you feel a lot more comfortable and kind of more in control.
Oh, yeah.
Yes. So male or even female or non-binary providers use chaperones during exams. So that's something you should know about. Yeah. So this is usually their nurse or medical assistant, and just make sure you ask before you undress. So you could say, okay, yeah, I would like a chaperone for today's exam. Okay. And most of the time they just do it now.
Can you bring your own chaperone? Like if you had your partner with you or a parent?
Or... Yeah, I've had lots of times there's 2 people in the room. And and there's no reason for them not to be able to stay. So you could do that, but still they probably will have their assistant
with them anyway.
That come in anyway, because it protects them and you to have that, and it helps it go faster. If all they have to do is hand the swabs off to someone who's going to actually put them in the fluid and send them off to the lab, so it make it quicker too. So so make sure you ask. And then there is this awkward part of how do they know when to come back in, right? So you're there, they say, please undress from the waist down. And then you're like, what if they're too fast?
Right. It is. It's horrible. It's very stressful.
And I'm too slow.
I got to hurry up. Where do I put my clothes? What am I doing?
Exactly. So are they just going to knock and walk right in?
But it's going to be hanging out in the air. Yeah.
No. So it's just terrifying, right?
Sure.
So here, what I say is, or what I would say as the patient is, how about I crack the door when I'm ready, and then we'll both know for sure.
That's a great idea.
I used to always tell my own patients, say, just crack the door. Not like you're opening the door. No, you're just cracking it. It's still kind of closed, but as soon as it's cracked, then you know your patient is ready and there's no guesswork. And then you don't have to guess when they're coming back. It's like, I have not cracked that door yet, so you better not come walking in. So it's like, this is between me and you, and we've agreed upon this. So that always made me feel more comfortable too.
That's a great one.
Yeah, speak up. So when you undress from the waist down, you'll have a drape, kind of like a disposable paper sheet to place over your hips and legs. And then
and you sit on paper too.
And you're sitting on paper
Lots of
too.
paper.
So it's all fresh paper. So the provider also may tap or gently palpate and push on your abdomen first, your stomach, right above your pubic bone, so where the bladder is. And just to make sure that there's no like really excruciating pain. And so they're just trying to check and make sure nothing else is going on. So could be just a normal part of the visit. So I always tried to do that too, to make sure I'm not missing anything.
So they're probably going to check on the outside before they go check on the
Absolutely.
Okay.
Yes. So start on the outside, work your way in. So you'll use stirrups to support your feet, and then you try to relax your legs apart. Wearing socks is a great idea.
That is a great idea.
I know, because I have cold feet anyway. So
Right.
as the patient part, sometimes the stirrups, they're not padded.
No, they're like metal and cold.
Yeah. So it's like, hey, I'm going to wear socks.
Right.
Just at least be a little bit more comfortable. So the outside of your genitals will need to be viewed as well.
This is when they start saying, scooch down. Come on, scooch.
Exactly.
Scooch.
Further, more. And you're like, oh my God, I'm going to fall off. Exactly. Yeah.
And then relax.
Yeah, scooch, relax. And you're like, really? So just so you know, when they're starting, they do really need to look at the outside. So there'll be a light, there's always that
Squeaky is always squeaky.
Squeaky long hose with a light on it so they can manipulate it and put it in the right areas. And so they need to look. So it's not weird that they're like,
crotch.
They're looking for a minute, but usually, they'll tell you when they're going to touch you, and then say, okay, I'm touching here, I'm going to touch here, and it's all with your permission. Anytime you're uncomfortable, you always have the right to say no. Even though you scheduled the exam, you have the complaint, you came in, you just say, wait, no, okay, we'll do this. Wait, I'm not ready for that part yet. Can you give me a minute? And I need to take a deep breath or something. And so you have the power always of yes and no, just like you do with a sexual partner. And throughout any part of your life, I always say you have the power of yes and no. So use it and don't not speak up like, we say that we did when we were in our 20s. And even through our decades of life, we still get sometimes anxiety.
Well, because you have this person of authority who
Exactly.
You think you should be following their instructions. But sometimes, if something's uncomfortable, you are allowed to say no.
Yeah. You can say no at any time. So please remember that.
But it is normal for the provider to be looking, touching.
Yes.
That is totally normal.
Yes, because they really do need to see the outside, because it's important if there is any concern of a sexually transmitted infection, because you can't see with your own eyes if there's any like tiny little blisters or ulcers in the labia or lesions of any kind. It's just really hard to find on your own. So that's why they really do need to look at the outside. So don't be surprised with that. And don't hesitate to ask for what you need, and let them know. For testing wise, there's not one specific test for everything. So a lot of times people will come in and go, just test me for everything. And it's like, well,
you're in there, right? You might as well be like,
yeah. But they're like, what does everything entail?
Mm-hmm.
So then you kind of got to go down a list, because you may not need everything. It just depends on your history. When was the last time you were checked with someone? Have you even had a new partner? Or maybe you haven't. And so the history part is enough. And the back and forth with the provider is super important. So you get what you need, and then they actually tell you options that you didn't even know that you had. So like, hey, we do have blood tests, and we can test for other things, like syphilis and hepatitis and different things, HIV. And so you just want to be at the ready to say, give me the list of what's available for me, or what else is available that I haven't thought of. Yeah. And remember, there is no judgment, just compassion and the desire to get all of the clinical stuff right so you can get back to your life. So you should never feel like the provider is judging you. They really are just there to help.
Well, like you, they've seen thousands of
Thousands.
vaginas.
Yeah, and trust me, we don't leave the room thinking of your vagina. We will never think of your vagina again. We won't even remember if you had hair or not. We don't dream about vaginas at night or count them as they jump over fences to get to sleep. So yes, please don't feel self-conscious about anything because we won't remember.
And you've probably seen it all. So
Yeah, definitely. Yes. Can name. Yeah, I'm not going to name.
let me tell you about. Yeah, you don't remember.
Oh, I remember. Yeah, about the piercings and all that.
So when they're ready to do, after they looked at the outside, then when they're ready to do an internal exam, how do you get into the vagina?
So the term used is speculum. So you may or may not have heard of it. So the speculum is the device that the provider used to insert into the vaginal canal and open it, shine a light in there so they can see what's going on and help to get the diagnosis.
Well, what does it feel like? Like if you could describe it to the listeners.
Yeah.
Putting in the speculum.
Yeah, very great question. What does this feel like? So it's not really painful per se. It just feels freaking weird. And it never gets any less weird throughout decades.
It's not painful, but it's not comfortable. It's just
right. It's uncomfortable. There's a little pressure.
Pressure. That's what it is.
Yeah.
It's just pressure.
And then the most common first-time response when you're getting a speculum inserted is
to clamp your knee shut.
Yeah. Well, yeah. You don't want it. Yeah. So try not to do that. But the provider's right there. So that, you're not going to get them in a headlock with your legs. They're going to make sure that you don't, you stay open. But is holding your breath.
Oh.
So when you're just like holding your breath, it's harder to relax your pelvic muscles and everything. So once you keep breathing, learn how to relax your pelvic muscles, then it's comfortable. You'll be carrying on conversations. You'll be laughing with your favorite provider during the speculum exam for years to come. So I had a patient who literally laughed her speculum right out of her.
Stop it. So I've been doing giggles.
But no, it's like, well, I mean, for some reason, my nurse was busy. I couldn't get a chaperone, and the patient really didn't want one. And so I had the metal speculum. So you can just, you turn a little knob and it just stays in place. So I had to just roll over to the counter a little bit to get my swab and everything. And as I was coming back, we were talking, and she laughed so hard, it literally flew out and landed on the floor. I'm like, oh no. Just I have to put another one in you now to get this. I said, but she thought it was hilarious too. Thank God.
So, Sandi, after you have the speculum in, then what? What to expect after that? What are they doing with the speculum other than looking?
Yeah, so we're holding it open so we can actually put a swab in.
Oh, okay.
And we can see not only the side walls to see how much inflammation is in there, see what kind of discharge, what color it is. Because sometimes if you just put a swab in and there's no speculum and take it out, you're not really going to know all of what's in there. Because you could pull it out, you might not see anything, or you may see a little clumping or something. But if there's other types of, if you see something that's more on the thin side, but then the thick side is adhered to the walls, you can say, oh, that discharge looks different from what's on the wall. So it might be like a gray or something else. And you're like, oh, there's something else.
What else you got up there?
Yeah. So, the exam itself, you should be using all your senses. So we're looking, we're feeling, we're smelling. So we're kind of, because that tells us a lot too of because some of the other infections are going to have different smells, consistencies, and all that. But the swab itself, again, it's going to feel weird, but not painful unless If there's a lot of inflammation, just that swab might feel a little stingy, but it's like for 5 seconds. Shouldn't take any longer than that. I mean, I could do pap smears and like in and out in 30 seconds.
Girl.
Like, come on now. So, it's just, you get good. Afterwards, you might feel a little uncomfortable due to the existing inflammation again, and maybe some light bleeding. All normal. And then that will go away very shortly. So if you have heavy bleeding, that's a totally different ballgame. And of course, you should come back if that happens. The samples all go into a sterile container. The provider should discuss next steps with you, like when and how are you going to receive your results, and do you need any treatment? So you can possibly be given a prescription right then and there, or better yet, have one sent right to the pharmacy of your choice. And after that, you get dressed, go to the pharmacy, and later get a call to confirm any other test results and additional treatment if needed.
That is wonderful. Thank you. Thanks for taking us through that, Sandi.
Glad I could help.
Part 3, Words of Wisdom for Your Support Person.
If you are special enough to be asked to accompany your partner or friend to their exam, because they certainly don't have to invite anyone, here are 4 practical tips on how not to be a douche.
Haha.
Number 1, put your phone away.
Put it away.
Yes. Don't be distracted. Be present for your loved one.
Do not answer your phone. If it rings, turn off the ringer.
Oh, yes. So annoying. Sorry. For everyone. Number 2, let the patient answer their own questions. Don't dominate the conversation.
No.
Number 3, if you also have a vagina, don't try to get free advice and make the appointment all about you.
Make your own appointment.
Please. Number 4, it's essential that you remain respectful and behave appropriately throughout the appointment.
Yes.
We will kick you out.
Yes, you can. Absolutely.
Mm-hmm.
Okay, listeners, put on your paper gown, crack the door, scooch all the way down, relax, and breathe. It's time for the summary.
We hope the Pelvic Pokey, the ins and outs of your pelvic exam, was helpful with how to schedule an appointment and what to expect during your pelvic exam.
All right, some key things to remember. Come prepared for your provider's questions. Write down your own questions. Remember, nothing in your vagina 24 hours prior to exam, if you can help it. Breathe. And confirm how to get results of any testing and when to expect them.
Yes, and please share this with your friends or anyone anxious about their vaginal exam and their partners too, so they all can feel more prepared and in control of their healthcare experience.
Well, you're at your appointment and you gave your history. Then they hand you a cup and you're glad you held your pee. You do the pelvic pokey and you check for a disease. Self-care's what it's all about. Love yourself, baby. Clothes are off, gown is on, and then you crack the door. Scoot to the end of the table, then you're asked to scoot some more. You do the pelvic pokey with a provider you adore. Self-care's what it's all about. Make sure you adore it. Put your left foot in a stirrup and you follow with your right. You breathe and relax open, cause it's gonna be alright. You do the pelvic pokey cause you need to shed a light. Self-care's what it's all about. Self-care, baby. You do the pelvic pokey. You do the pelvic pokey. You do the pelvic pokey. Self-care's what it's all about.
I'm Sandi.
And I'm Beth.
And if you have a vagina or know someone with a vagina, then please like, share, and send them our way. Go ahead, spread it around.
Feel free to spread it.
You can find us on all podcast platforms like Spotify, Apple Music, and YouTube. Bye, everyone.
Thanks for listening.